can I start off by saying that we have one new community case, but it's in home isolation. It's part of that Indooroopilly cluster, and it's the last person of a particular family. So we have absolutely no concerns about that. And can I take this opportunity to thank all of the families associated with that Indooroopilly cluster that actually went into quarantine and did the right thing. And to each and every one of you, you're local heroes, and you kept Queensland safe. So we are eternally thankful for you doing that. So we now have 26 active cases. We've done 6,500 tests in the last 24 hours. So keep that up. If you have any symptoms, please, Queensland, go and get tested. And I thank people for coming out and getting tested. And we had 14,843 vaccines by Queensland Health yesterday. And the good news is we're at 49.44% of eligible Queenslanders have had their first dose, and 30.74% have had 2 doses. So that's absolutely brilliant news. Well, today I'm joined by Dr. Young, and we're also pleased to announce that from September the 8th, we will be opening up another big vaccination hub at Boondall. So we recognise that there's a lot of families living on the north side that may not necessarily travel into the Brisbane Convention and Exhibition Centre. So we'll be using Boondall. There's going to be heaps of parking out there, and that's going to be set up, and that'll be another mass vaccination hub. So it will open up to its first 1,500 bookings, and it will ramp up to 3,000 a day. So if you're living on the north side and you're thinking, hey, now's the time for me to get my vaccine, you'll be able to go to Boondall in just over a week and a half, and you'll be able to get your vaccine there. And we'll see more and more of these open up as we get more and more supply in. And I want to thank Queenslanders for coming forward and getting their vaccine. And I'm now getting families coming up to me saying our family's totally vaccinated, which is excellent news. And I'm also getting a lot of questions now from families about when can my high school student get a vaccine. So we're working through all of those issues, and as soon as we get the supply, there'll be clear communication from the federal government and from us about where people can go and get those vaccinations. So that's wonderful news. Now this weekend, Queenslanders have had the opportunity to go out. Cafes, bars and restaurants have been able to have more people in them. More people in parks. I think there's a small function happening over behind me today in this park as well. And I am very happy that Queenslanders are out enjoying our Queensland lifestyle. But we have to be on our guard. So, you know, it is a race, and in terms of getting your vaccine, every single day that we don't have Delta in our state is a day that you can go and get vaccinated. The more people we get vaccinated before another outbreak helps protect more of our community. So every single day is critical from now until the next outbreak. So if you haven't registered for your vaccine, please log on to the website, the Queensland Health website, and put down for your vaccine. And send me your photos of having your vaccine as well. I'd love to see them, because I love to see when Queenslanders are proud to have their vaccine, because we're all in this together. We're all going through the same thing together, and we all want to come out the other side. And for me, it's fundamentally important that I do everything I possibly can to protect our wonderful Queensland lifestyle and our way of life. So we'll be working very hard. Finally, I just wanted to add that our State Disaster Coordinator is meeting with the Border Commissioner today. We had some exchange of letters, you may recall, on Friday. And, you know, Queensland has put an option there very clearly to New South Wales to, you know, I wouldn't even call it a border. It's about having a border bubble. Like it's not extending the border. It's about making it easier for those communities to coexist together. And look, I just hope that the New South Wales government can work with the Queensland government here, because it's having an impact on families' lives. So we've extended the olive branch, and we'll hand it over to New South Wales now to see if they'll come to the party. But you know, we're trying everything we can from our end. I just want to reassure those border communities down there, especially around the Tweed, that we are trying everything we possibly can. And we've sent in our State Disaster Coordinator, Steve Goloczewski, the Deputy Commissioner, to have those talks with the Border Commissioners. So fingers crossed there'll be some outcomes there. But look, I'll hand over to Dr. Young, and then we're happy to take a few quick questions. Thanks, Dr. Young.
Thank you. So another excellent day. We have another case related to the Indooroopilly cluster, but they've been in quarantine during their entire time they're infectious. And it actually means for that family, every single person in that family is now positive. It's been quite a journey for them and for a lot of other people. So I do thank all of those people who protected the whole of Queensland through what they did. It was fantastic. Now, every single day that we don't have an outbreak in Queensland gives us the opportunity for another 50,000 Queenslanders to be vaccinated. So please, as you've been doing for a long time now, since the 22nd of February, please come forward and get vaccinated, because it means when we do have the next outbreak, which of course we will have, I hope it's a little time off, but we will get more outbreaks. The more people that are vaccinated, and I know there's a target of 80% out there, I'd like to see 95% of course, but anything is excellent above that 80% target, will help us manage the next outbreak in a different way to the ways we've had to manage previous outbreaks to keep Queenslanders safe. So that's excellent. We are just continuing to open up more places for people to get vaccinated, and of course our GPs and our pharmacies are getting more and more vaccine every single day. So look around where you can get vaccinated and where it's most convenient for you. It's really important as we go forward. Thank you.
Thanks, Dr. Young. Happy to take some quick questions.
Premier, you mentioned there about the border being closed. We had an interview with the Deputy Premier Palaszczuk from New South Wales yesterday saying that he wanted to see the border issue solved by today. What's the hold-up? If you're holding out an olive branch, why aren't they accepting it?
I don't know. I hope they are being genuine, because we are. We are absolutely being genuine here. So hopefully the Border Commissioner from New South Wales and our State Disaster Coordinator can work together in the best interests of those communities.
Is it a case that they simply don't want the actual physical border moved or something there? I mean, what's your understanding of the situation?
I don't know. Look, I've tried my hardest, so, we're trying again. We're throwing everything at it.
You must know what the issues are, though. What's the hold-up? Do you know why they're reluctant to do it?
Go and ask New South Wales. It's not from us.
In a statement yesterday, Deputy Premier Palaszczuk did say that he had in fact contacted Queensland, that he'd written a letter personally to the Health Minister, which had gone unanswered. So
No, that's not correct.
So he hasn't written a letter?
He's written a letter, we've seen the letter, and our State Disaster Coordinator's talking to them, but we wrote ages ago. This is in response to our letter that we wrote. I'm not again an argy-bargy here. Let's get this sorted, okay? So I know New South Wales is really busy, and if they're nominating the Deputy Premier down there to work with our Health Minister, let's work together and get it done.
Just final question on it. Is there anything that you'd particularly like to see to make the border bubble work then?
Well, as we said, it's easier if you move those checkpoints to the river.
but is Queensland open to a border bubble of sorts?
I wrote the letter in the first place. You can have all the correspondence. They'll hand it out on Friday. Yeah.
In that regard, we've got planned protests today. If they go ahead and you see scenes like last Sunday, what would your message be?
Well, that's disappointing because we're trying to do everything we possibly can, and the fact still remains that New South Wales has a stay-at-home order. So they would have to lift that stay-at-home order for those communities living in that Tweed part of New South Wales.
Premier, if the bubble goes ahead, will it be our police over on the guards, or will it be New South Wales police helping protect them?
Sorry?
If the bubble goes ahead, will our police, Queensland police, be allowed to cross into that bubble and do the set there at the gates?
They're all the issues that the police will work out together. Yeah.
Premier, do we know when Queensland might hit that 80% vaccination rate?
Look, we're doing some forecasting and modelling now, and it depends on supply. As I said the other day, if the federal government gives us supply, we'll put the supply in people's arms. So as soon as we get that supply, and hopefully there's more to come, we know there's more due, I think from memory, at the end of September and October. We're looking forward to hearing when we get the Moderna. I understand the Moderna vaccinations ready to go soon, so we're looking forward to seeing how much Moderna Queensland's going to get. So as soon as we get all those facts and figures, we'll get it out. We'll get it out. That's why we're getting extra mass vaccination centres up and running.
Is it concerning that we have, I think it was 10 of the slowest vaccine take-ups across Queensland local government areas?
Look, we want to see more of our local governments, and I'll talk to the Deputy Premier to also maybe convene another teleconference with the mayors tomorrow, early this week too, to just stress how important that message is from mayors as well and local communities. We want to see the vaccination rates, lift simultaneously around the state, but we recognise we are the most decentralised state. We don't have all our population centred like Victoria and New South Wales do in Sydney and in Melbourne. We are very decentralised, and I look at those results every week to see how we're tracking, and you'll see that we're targeting now where we need to lift those vaccination rates up in people. But it's good to see we're almost at that 50% first dose, so I'm very encouraged by that.
Premier, if you can't resolve the border issue, do you fear that these protests will keep going on, because they've vowed to do it every Sunday until it is resolved?
Yeah, well, look, I'm trying. We're trying our hardest. So let's see what happens with the discussions between the New South Wales Border Commissioner and our State Disaster Coordinator. I mean, I think we've sent one of our best in. Everyone knows how good our Deputy Commissioner is, Steve Goloszewski. So if anyone can get it done, Steve can.
And who exactly is he meeting with, sorry?
The New South Wales Border Commissioner.
Sorry, could I ask Dr. Young?
Yeah, sure.
About vaccination?
Sure.
That vaccination hub at Boondall, is that the Boondall Entertainment Centre? Can you tell us a
Yes.
bit more about that?
Yeah. Yep. So that'll be put in place, and the things that I think a vaccine hub needs is lots of parking, and we've already seen how effective that is, and it's got to be free, of course, the parking, which it is, and then space so that they can adequately monitor people. We've been very fortunate that we've had very few people have adverse reactions to the vaccine, but where it has occurred, it's been managed beautifully. So we need to have the health staff there with the space and the ability to just manage the whole process.
Is that because you're literally about to see a lot more Pfizer coming over?
Yes, yeah, we're seeing more every single day. So please, could everyone register for a vaccine who hasn't already? Because you'll then very quickly get appointments. I know there are people registering one day, and within days they're getting offered an appointment. So just come forward and you'll be able to get vaccinated.
Can I ask you about Moderna? When do you expect that to be a part of our vaccination effort? Is that the end of this month?
It depends. It depends on the decisions that the Commonwealth is making, but within the next 4 weeks, yes.
Dr. Young, with that new case, does that whole family have like rolling isolation? Do you know how many days they've been in isolation?
Right, so that's related to the original cases in Ironside State School, so it goes back as far as then. So that household has been in quarantine since then, which is astounding. They've done an amazing job.
Wow. And just some questions about the new restrictions around smoking around South Bank and with e-cigarettes. I guess walk us through those changes and I guess how you think they'll help with us smoking.
Yep. So Queensland is yet again making more places smoke-free, which is extremely exciting because we still know that one of the biggest risks to an individual's health is smoking. That causes more deaths and more harm than any other factor. So anything we can do in Queensland, as the government has just done now, to increase the numbers of places where people can't smoke, we know that helps because it helps the people who are trying to give up smoking, that they're not exposed to that trigger, because often it's a trigger to smoke yourself if you're in an area that other people can smoke. So removing that trigger is vital to assist people, and we know that the vast majority of people who smoke actually do want to give up, but it is an extremely difficult thing to do. I mean, I just applaud anyone who has stopped smoking. It's a very, very hard thing to do. We've got a lot of strategies in place to help people stop smoking. So you can ring the Quit line and they'll assist you. We can assist you with patches. We can do a whole lot of things. But despite all that, it's still a really tough thing to do. But I encourage anyone who's smoking today, no matter how long you've been smoking, give up today, because that will immediately start helping your lungs. So thank you for that question.
What progress have we seen on that, the trimming down of that essential worker list that you had the Department Director General doing a last week or the week before.
Yeah, so all of our Director Generals in Queensland have worked together under the leadership of Rachel Hunter to look at who is critically essential to Queensland, because we know that we are going to get a case come into Queensland and none of us wanted it to be through the essential worker pathway. So we've just been making sure that those people are absolutely essential. And businesses and services have done a fantastic job. So we see a lot of people move from the border zone into Queensland and vice versa. So a lot of people have just swapped their roles for a while, which is very sensible. We've seen other people relocate temporarily while this is happening, because we have seen those positive sewerage results gradually creep closer and closer to the border. So it's important that we just make sure that we minimise that risk, and that's what's been done very collaboratively.
And has there been a particular sector or sectors, I suppose, where those numbers have been reduced, I suppose, more significantly than others?
Yeah, probably the health sector, because in many ways I'm most concerned, of course, about bringing the Delta variant specifically into our hospitals and our health care, because we know it can spread. And unfortunately in New South Wales today we're seeing deaths of people who acquired the infection in hospital. And of course no one wants to see that. New South Wales doesn't want to see that, and they're putting in place a lot of strategies to prevent that, and I'm doing the same here in Queensland, just to make sure that we don't get the Delta variant into our hospitals, because we know it would spread and we know it would cause cases and potentially deaths. So that's the work that's been done so well by all of the different people involved, the private sector, the public sector, our own Director General in Health, and all of our Chief Executives.
And is that still, I suppose, trying to be trimmed down further, or are you happy
Yep.
where the numbers
Yep,
are?
they're working that through, and as I said, some people have actually made a decision to relocate, and they'll do 2 weeks quarantine before they go into work in the health sector.
One last question for me on Olympics. How's
Yeah.
the government going organising the Olympic Committee?
Yeah, thanks. I can report that we had another meeting just on Thursday, of our Olympics task force. So it was great. John Coates was back in the country. He was able to chair that meeting, and a lot of enthusiasm, of course, and very proud of the work that happened in Tokyo to secure the Olympics. So we will be working through a number of issues now, and we'll have in place some legislation before the end of the year. So I would imagine that I'll be introducing that legislation next month into the Queensland Parliament.
Do you have an update of
Sorry, that's for the organising committee.
Yes, yes. Yeah.
And just finally, there's a lot of talk about Brisbane getting some amazing transformative icon for the Olympics. What's your idea around that?
Oh, look, I'm open up to all ideas, but don't forget we've got some new infrastructure going in place that sort of moulds into our Cross River Rail, so it could all be part of that. But also too, don't forget too, we have amazing light installations as well that you would see at Goma. So it doesn't have to be, hundreds of millions of dollars. We can do something that's quite spectacular that could even light up Queensland landmarks. So open for suggestions, and please send in your ideas. Love to hear them.
Premier, is there a short list yet for who might lead that organising committee?
No, not at all. No, this is like such early days. We're 11 years out, so we'll be making sure we get things right. And there's going to be a lot of people out there with a lot of ability. It's going to be really tough narrowing down as to who actually sits on that committee.
Premier, we've extended the use of the check-in app to taxis and ride shares
Yes,
now.
yes, which is great. And can I thank everyone for using that check-in app? And just a reminder too, please make sure you do use that when you're using ride share and taxis.
Yeah, and the governor previously said it was working out whether legislative changes or a policy directive could block police accessing the data like we saw up in around Gladstone there.
Yeah, that's a good
Has
question.
there
Yeah,
been a decision reached on that yet?
not yet. Government's looking at those policy issues at the moment. Yeah,
That's still being worked
yeah,
through at the moment.
yeah, actively looking at. Yeah.
Just one last one. Do you have an update on the number of Afghan refugees we currently have in Queensland and how that's being worked through?
All I know is that we were asked to take, I think from memory, an additional 2 plane loads, and we said yes, of course. and we'll be working very closely with Defence, and the Prime Minister actually thanked all the states for doing that as well, and yeah, looking forward to having them as part of our community.
And just finally, one from me. The Treasurer overnight has said that he's concerned that we're faced recession if we don't open up once we reach 80%. What's your response to that?
You mean Josh Frydenberg?
Yeah.
Well, I say to the Federal Treasurer, Queensland's open. Come and have a look.
Okay, thanks everyone.
Thank you.
The light little girls over here are hoping they can take away.
Oh yeah, sure.
Come out to take photographs.